Hi, Dr. Evan Che here from Kinetic Rehab Spine. Listen, I see you probably looking at this crazy device that's in front of me, but if you look at this light bulb, see this is sending electrical currents inside my body. Now, why is that so important when you have neuropathy? Now, it doesn't matter whether you have peripheral neuropathy, diabetic neuropathy. The reason why you have neuropathy from a root cause from a Chinese medical perspective is the fact that you have low voltage. So each cell in the body needs about minus 25 millivolts to function. If we don't have minus 50 millivolts, we're not going to be able to replicate the cell. So for example, say you had neuropathy into your feet or your hands for a longer period of time. By that I mean any kind of chronic issue is you'll have neuropathy or symptoms for 2 to 4 weeks. Anything longer than 4 weeks is a chronic issue. Then the brain and nervous system has to change, right? And it changes in such a way where the brain starts smudging itself. And so you can't really, the brain can't delineate where your symptoms are coming from at that point, and then it starts traveling further down your arm or down your leg. Now the root cause behind that is the fact that you have decreased voltage to a cell. In your case, it'd be the nervous tissue cell, all right? Now, I want to show you a quick diagram. Now, if you take a look at this, this is known as Ohm's law. I equals V over R. I stands for the current. Current also means nervous system. So if you think about nerves leave the brain, leave the spinal cord, they go down into the extremities, they go down to your fingers, they go to each organ system, they go to each muscle, each joint, etc. So when the nerve is being compressed or the nerve is not functioning very well, it's going to cause tingling numbness someplace else. Now, what if you took a medication that caused it? The same thing happens. The medication lowered the voltage of the cell. Now the cell becomes dysfunctional. All right, so I equals V over R. V is voltage. Voltage needs to be between minus 25 millivolts to function normally and minus 50 millivolts. This is from Dr. Tennant, MD's research. R stands for resistance. Now, for example, if I increase my resistance, current has to be reduced. So if I have resistance, that goes up, current also goes down. So if resistance go up, the nervous system function to that organ system or muscle or soft tissue becomes lowered. All right, so now, sorry about that guy, but let's just draw this a little bit better. Perfect. So say resistance is normal and voltage drops. What has to happen to I? It also drops. Does that make sense? Now, most people have low voltage and high resistance. So then the current becomes even more dysfunctional. Does that make sense? So you might have tried different types of treatment. Maybe tried physical therapy, acupuncture, occupational therapy, injections, whatever it might be, right? But they didn't look at it from this perspective most likely, right? They're chasing the symptoms. What I want to do is teach you about how the cells function, how the nervous system functions, so you can rehab yourself. Does that sound good? All right. So if we understand these principles and concepts, then we can actually break out how do we lose voltage, and then how do we increase resistance, and then how do we rehab it. Does that make sense? All right, cool. So let's take a look over here. Voltage. Traditionally speaking, for the past 5,000 years, Chinese medicine has been talking about qi, and Ayurvedic medicine or Indian medicine has been talking about prana. They're both the same. It's all about voltage. We also call it universal energy. Have you ever noticed when you go to the beach or you're on vacation and you're feeling absolutely amazing and you're like, oh man, I feel so good, and you think it was time off from work? Yes, that's part of it. The second part is this. Whenever we're in nature, we're getting electrons donated to us. So we go for a hike in the woods. The trees are sending and giving us electrons. Or even better yet, how many of you have a pet? And you come home, the pet jumps up and it loves you, it kisses you, holds you, right? And it makes you feel so much better, right? That's because that dog, that pet, that cat, whatever it is donating electrons to you, all right? That's pretty cool. Now, when we walk outside barefoot, the earth is actually donating electrons to us as well. And it's a donation of electrons that actually increase the cell voltage. That's why you feel better. So one interesting thing that I always found with my neuropathy patients is actually go outside barefoot on the grass. Now, if you don't really feel your feet very much, just sit down, put your feet on grass. Even concrete works for you as well. And just feel the grass, because the grass is going to donate electrons to the body. So is concrete. Blacktop doesn't really work. It blocks it, all right? So get out in nature, hug a tree, literally hug a tree, all right? All those things donate electrons. So We have 4 battery packs that allow us to have proper voltage going to each cell in the body. Number 1 are the muscles. The muscles are the biggest battery pack. They're also an endocrine organ. So that's why I'm such a big fan of muscles, strength training and exercising, because anytime we move, we're actually building electrons inside our body. There's a biochemical reaction called the piezoelectric effect. So every time I contract my muscles or exercise or a squat, I'm actually building electrons. Now what's interesting is this. The Chinese were able to find that when you stack different muscle groups on top of each other, it creates a battery charge, a battery pack. And it follows a pathway. The Chinese have been able to map the 12 pathways of the body, which is pretty wild. And they communicate via what's known as a wiring system known as fascia. So every time I contract my bicep, I'm actually engaging my lung as well as my heart and my pericardium just by contracting my bicep, right? Because I'm donating those electrons to that end organ, right? So what they've been able to do is able to track where the muscle pathways go and which organs they actually fill. So very important that you exercise, number 1. Number 2 is we have something known as a cell membrane. Cell membrane, the brain of the cell. Each cell has its own membrane. We have trillions of cells inside our body, right? And so if the cell membrane is dysfunctional because we eat poorly and we take in vegetable oils or canola oil or trans fats, the cell membrane becomes extremely dysfunctional. And then electrons can't get inside the cell. And if electrons can't get inside the cell, guess what happens to nutrients? They can't get inside the cell as well. That's known as homotoxicology or homotoxicity. Homo means human, toxins don't allow, it binds to the receptor sites, doesn't allow nutrition into the cell. Specifically vitamin B6, Dr. Ellis did extreme, incredible research on vitamin B6 deficiency and neuropathy. Pick up his book on B6 deficiency and you'll love his book. However, if we have a deficiency of electrons or a toxicity of something, the cell can't get B6 in. Note to self. Third thing is the mitochondria. The mitochondria is the powerhouse of the cell. And we have trillions of cells, and if the mitochondria doesn't have proper food, right, through exercise gives food to the mitochondria, but so does energy, like something like the BioCharger here. And the nucleus. Those are the 4 battery packs of the body. Now, what causes the voltage to become dysfunctional? Number 1, scars. If you have any scar in the body, I don't care how old the scar is, it's going to short the circuit out. Remember, muscles are battery packs, so anytime you have a scar anywhere in the body, it's going to short that neurological input to the nervous system, and it's going to cause dysfunction. And emotional trauma. Any kind of emotional trauma can affect the ability for the voltage of the cell to function. Here's a great example. I was treating a woman about 5 years ago. She had peripheral neuropathy secondary to chemotherapy from breast cancer and breast surgery. And we couldn't really help her with the acupuncture and the herbs didn't really help her. So I did something with her was this. What I did was I actually had to go back in time and I had her visualize herself getting the chemotherapy at that time. And I had to do a specialized technique called emotional freedom technique. And I had her actually tap on certain acupuncture points, visualizing that time when she was going through the chemotherapy. And specifically more when she was inside the shower. She found that when she was in the shower, she cried a lot. So I wanted her to visualize that time and clear that emotional trauma at that time. The next day, guess what happened? She came back in to see me. She said, all my numbness was gone. So these emotional traumas, they can be stuck somewhere inside the body and they can be causing you the inability to get rid of your neuropathy. Next, 4 things, autonomic dystonia. We have a nervous system that's automatic inside our brain and nervous system. And this nervous system is known as the autonomic nervous system, also known as the automatic nervous system. And we know the heart's beating without us actively beating it, right? We know we're digesting foods without us actively digesting foods. When there's a dysregulation in this system, the body starts breaking down. It lowers the cell voltage. When we have high stress, also known as high sympathetic tone, we're not gonna be able to sleep very well, and it's gonna affect our sleep-wake cycles. Then if we have chronic inflammation or hidden infections, it's gonna affect the ability for the cells to produce new cells because voltage is low. Next thing is resistance. Scars again. So if resistance is low because we have a scar and emotional trauma, it's gonna affect the ability for the nerve to function. And then the 4 zones. Now we call this asymmetry. If you look at my spot in my body, If my pelvis rolls this way, my pelvis is rolled forward here, my foot has to collapse in on this left side. But then my spine has to counter-rotate here. Then my head has to counter-rotate here. And it's going to affect 4 zones of the body. And so if we have a pathobiomechanical movement, meaning this, we have a joint or a muscle that's compressing nerves, distally, it's going to cause neuropathy. So in our clinic, what we do is we look at all the aspects. We look at how you're eating, how you're moving, how you're thinking, how you're feeling, how you're supplementing. We look at all the aspects because I guarantee you, if you just do physical therapy alone for neuropathy, it's not going to work. If you just do occupational therapy alone, it's not going to work. If you just do acupuncture alone, it's not going to work. If you just do all 3 of those without adding the nutritional component, it's still not going to work. Because we're going to treat the symptoms, we're going to treat the root, not chase the symptoms. And if you want a free consult on a neuropathy program, please feel free to come to the office, schedule a free consult, click the link below, 201-327-1990. Sempre Levante, always forward.